Hi everyone, this is Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, today we have another mini mixed bag marathon session, and this session is targeting upcoming exam NEET-PG for year 2023. And in this session today we are going to practice questions of radiology, pediatrics and dermatology. So my dear friends, let's start our today's session. I hope that your preparation is going on very well. You are practicing question every day, and don't forget to practice PYQs, my dear friends. PYQs are key role player in every exam. So let's start our today's session. Here we go with our question number one. So here the question is, a child was born with absence of thymus gland and congenital hyperparathyroidism. This is likely to be due to maldevelopment of which of the following structure? First, second, third, or fourth. So my dear friends, here the correct answer will be option number C, that is third pouch. Okay, third pouch is here maldeveloped, and the clinics of this question is representing it as D George syndrome. Okay, and in D George syndrome you will see that third and fourth pouch both are maldeveloped, but the main contribution will be of option number C, that is third pouch. ओके माय डियर फ्रेंड्स, मेन कंट्रीब्यूशन किसका है? थर्ड पाउच का। डीजोर सिंड्रोम में थर्ड पाउच और फोर्थ पाउच दोनों ही माल डेवलप्ड होती है, बट जो मेन कंट्रीब्यूशन है, जो मेन रोल प्ले कर रहा है डीजोर सिंड्रोम में, वो कौन सा है? थर्ड पाउच है माय डियर फ्रेंड्स. सो हियर द करेक्ट आंसर विल बी ऑप्शन नंबर सी, that is third pouch, my dear friends. Now you can remember Dijon syndrome by a mnemonic here. So here you can see the mnemonic for Dijon syndrome. It is catch-22. C is for cardiac abnormality, A is for abnormal faces, T is for thymic absence or abnormality or T cell abnormality, C is for cleft palate, H is for hypocalcemia, and 22 it is representing chromosome number 22. In DiGeorge syndrome, you can see the micro deletion of chromosome number 22. Okay, my dear friends, and here you can also note down neonatal seizures or tetany. Okay, here the features are shown, my dear friends. Abnormal development of neural crest cell, then you can see low set of ears, wide set eyes, a small jaw. Okay, so you can see all these clinics here, my dear friends. So let's go to next question. Which is most specific clinical feature for diagnosis for Kwashiorkor? So my dear friends, the specific clinical feature for diagnosing Kwashiorkor, it is pitting edema. Pitting edema, it is very specific sign for diagnosing Kwashiorkor. So here the correct choice will be option number D. Okay, that is edema and it is specific sign. An infant is admitted to ICU with complaints of recurrent jerky movements of limbs. EEG showed Hypsarrhythmia, which will be anti-epileptic drug of choice. So my dear friends, here the correct choice will be option number A, that is injection of ACTH. This condition, it is representing West syndrome. It is representing West syndrome, and in West syndrome you can see triad of symptom, that is infantile spasm, okay, attacks of flexor spasm and developmental delay and hypsarrhythmia on EEG. So all these complaints are given in this question. Drug of choice will be injection of ACTH, that is adenocorticotropic hormone, and drug of choice for West syndrome in a child with ट्यूबरस स्क्लेरोसिस. अगर चाइल्ड किससे सफर कर रहा है? ट्यूबरस स्क्लेरोसिस से, तो वहां पर क्या होगा? वेगा बैट्रिन. So my dear friends, here the correct answer will be option number A, that is injection of ACTH. For a preterm baby, what is best suited in the absence of breast milk? Term formula milk, preterm formula milk, donor breast milk, or cow's milk? So my dear friends, here the examiner is asking best suited milk. Okay, in absence of breast milk. Okay, So my dear friends, here the correct answer will be option number C, that is donor's breast milk. Okay, first choice will be donor's breast milk. If it is not given in the option, then it will be preterm formula milk. If preterm formula milk is not given, then the another choice can be undiluted cow's milk. So here the correct choice will be option number C, that is donor's breast milk, my dear friends. Which is most common cause of neonatal sepsis in India? So my dear friends, in India the most common cause is Klebsiella pneumoniae. Klebsiella pneumoniae, it is most common cause of neonatal sepsis in India, my dear friends. At what age does baby attains half height of adult height? So my dear friends, you must remember these parameters in pediatrics. So you have to choose here the age group at which baby attains half height of adult height. So here the correct choice will be option number C, that is 18 to 24 months, my dear friends. Match the following. So my dear friends, here examiner given different kind of dermatological condition, and here examiner given different clinics. So my dear friends, here you have to match correct dermatological condition with correct sign. So my dear friends, here first you see option number A, that is silver scale, and silver scale it is seen in psoriasis. Silver scale it is seen in psoriasis. It is available in any option? Option number A. ओके, सो पहला ऑप्शन देखते ही आंसर करेक्ट हो चुका है हमारा। ठीक है, आगे हमें कुछ देखने की जरूरत नहीं है। सिल्वर स्केल किस में दिखते हैं? सोरियासिस में दिखते हैं। तो ऑप्शन नंबर ए इट इज अ करेक्ट चॉइस। बी का क्या होगा? ब्रेन स्केल, इट इज सीन विद पेटिरियासिस लाइकेनोइड्स क्रोनिका। Colorate of scales, it is seen with Pityriasis rosea. Okay, mica-like scale, it is seen in Pityriasis versicolor. So my dear friends, here the correct answer will be option number A. So let's go to next question. Here we go. A patient having hyperglycemia comes to physician. He is having hyperpigmentation of the skin as well. On examination, he was found to have micronodular cirrhosis with increased iron deposition. Which of the following is likely cause in this patient? So my dear friends, I think the correct answer will be option number B, that is hemochromatosis, because we can see here the micronodular cirrhosis and with increased iron deposition, my dear friends, iron deposition and hyperpigmentation also, and it is seen with condition hemochromatosis. So here the correct answer will be option number B, that is hemochromatosis. Here you can read hereditary hemochromatosis causes your body to absorb too much iron the food you eat. Okay, excess iron is stored in your organ, especially liver, heart, and pancreas. So my dear friends, here the correct answer will be option number B, that is hemochromatosis. Identify the variant of psoriasis in given image below. So my dear friends, you have to identify the variant of psoriasis here. And my dear friends, this is gutted variant of psoriasis. Here the correct choice will be gutted variant of psoriasis, my dear friends. Spot diagnosis based on clinical image shown below, my dear friends. So here examiner giving you this image, and you have to tell the diagnosis for this image, my dear friends. So here the correct answer will be option number C, that is acanthosis nigricans. Okay, here you can see the fold of skins are involved. Okay, neck folds are involved, hyperpigmented lesion you can see here. Okay, and velvety appearance. This appearance here you can see, this is velvety appearance, my dear friends, of the skin, and neck folds are involved, hyperpigmented lesion. All these conditions are representing here it as acanthosis nigricans. Identify the condition shown in this image, my dear friends. You have to identify this condition, and here this honey colored or golden color appearance, it is representing this condition as impetigo. The most common site for impetigo, it is face, and these superficial lesions which are forming honey color, These crusted lesion over erythematous base are showing itself as impetigo. Impetigo, it is of two types, bullous and non-bullous. And in this image, the examiner given us non-bullous type of impetigo, that is impetigo contagious, and it is caused by agent streptococcus more than staphylococcus aureus. दोनों से होता है लेकिन मेन पॉजिटिव एजेंट कौन सा इसका, स्ट्रेप्टोकोकस. एंड हियर यू विल सी गोल्डन येलो और हनी कलर्ड क्रस्टिंग बुलाई. Okay, and in bullous you will see bullous type of impetigo, their causative agent is staphylococcus aureus, and subcorneal epidermal separation can be noted down, my dear friends. A child with history of recurrent UTI is presented to OPD. X-ray finding is given below, my dear friends. You can see it is a case of UTI. Okay, what is probable diagnosis? So, my dear friends, here the probable diagnosis will be vasicoureteric reflex. So, this condition, this image is representing itself as option number A, that is vasicoureteric reflex, my dear friends. So, the correct choice will be option number A here. What is not investigation of choice to diagnose this disease? My dear friends, here you can see this appearance is bird beak sign, and it is best diagnosed with manometry, then endoscopy, and then barium swallow. But 24 hours pH, it is not an investigation of choice for diagnosing this condition. Bird beak sign, it is confirmed by manometric, endoscopic, and radiographic investigation. Endoscopy भी है, manometry भी है. Esophageal manometry, it is regarded as gold standard in diagnosis of achalasia. This condition is of achalasia, classically showing peristalsis and failure of relaxation of lower esophageal sphincter, my dear friends. ओके, यहाँ पर क्या दिखा रहे हैं हम, लोअर इसोफेजियल स्फिंक्टर का फेलियर दिखा रहे हैं, और इसको बोलते हैं बर्ड बिग साइन. और इसको डायग्नोस करने के लिए मैनोमेट्री है, एंडोस्कोपी है, और बेरियम स्वेलो का यूज करेंगे. लेकिन ऑप्शन नंबर बी क्या है यहाँ पर इनकरेक्ट है, वो हम यूज नहीं करेंगे. A 12-year-old boy suffered orbit injury with cricket ball. Next day developed diplopia with upgaze. The boy develops headache, dizziness, vomiting on looking up. Also developed bradycardia and hypotension on looking up. No congestion or proptosis of eyes. In probable cause will be. So my dear friends, here the probable cause will be option number A. That is fracture floor orbit, or you can also note down it as blowout fracture, my dear friends. So here the correct answer will be option number A. A patient comes to OPD with complaints of daily purulent sputum production. Identify the condition given in this image, my dear friends. So here you can see in image the signet ring appearance, and this signet ring appearance, it is identical to option number B, that is bronchiectasis. This is identical to option number B, that is bronchiectasis. And you can also note down tram track appearance or tram track sign and signet ring sign. Both are seen or both are associated with bronchiectasis, my dear friends. Identify the view given in this image, my dear friends. You have to identify this view, and this view is water's view. Water's view, it is associated with, it is associated it, or it is known for maxillary sinus. Okay, it is known for maxillary sinus. You can see the skull at is angled at 45 degree, and it is most commonly used for knowing about maxillary sinus, my dear friends. Think correct answer. Okay, and examiner giving you here a image, and this image is showing us something like woolly appearance. It is cotton wool skull, and it is seen, or it is associated, or it can be said as a radiographic finding of Paget's disease. So my dear friends, this cotton wool appearance, it is associated with Paget disease. Here you can see sclerotic ill-defined patches or appearing cotton wool like. So my dear friends, this is all about our today's session. If you feel that this session is helpful, then like this channel, share this channel, and subscribe to my channel for upcoming updates. Thanks to everyone. Stay safe, stay healthy, and keep practicing every day questions. Whenever you get time, practice questions as much as you can, my dear friends. So bye bye. Thanks to everyone. Stay safe, stay healthy.